Continuing on to episode 5 of The Pitt. Learning a lot watching the show, and it's kind of getting me excited to get back into the ER. I don't know if I will, but we're definitely gonna watch this episode. Huge thanks to Grammarly for sponsoring this video. Let's get started. Be-woo!
Vacuum twice a day, warm soaks. We'll see you here again in 2 days for a wound check. Got any questions?
Oh, hey, I need a gurney here! Now!
Looks like what the person's experiencing is a seizure. You really want to protect the airway in a situation like that. If they're laying on their back, you want to put them on their side so that they're not aspirating if they do vomit. And you never know why that person is having a seizure. Is it related to blood sugars, brain trauma? Because you don't know why that person is there. They're non-communicative.
What do we got?
Seizure in chairs.
In a situation like this, you really want to break the seizure given how long it's going on. Usually that's done with a benzodiazepine. Sometimes we do it rectally.
Lorazepam's on board.
That's the benzodiazepine I was just talking about.
Okay, drop another 4. Yeah, no history. Doesn't look like he's been here before.
Starting low 90s on 5 liters.
That means his blood oxygen saturation is 90%, 5 liters of oxygen going through the nasal cannula. 90% is not ideal for a healthy person, but it's not also in a dangerous level either. Like, that's a stable number.
Another 4 milligrams?
Can't get the top off.
Oh no, don't poke him. You gotta be careful when you're handling sharps. You don't ever handle sharps while putting your focus elsewhere. Whenever a sharp is in your hand, the only thing you're focusing on is on that sharp. Otherwise, it's gonna end up in the patient, in yourself, in one of your coworkers. Big problems.
Here, give it to me.
Oh no,
I
don't
got it.
poke him!
Okay.
Even the way she's drawing it up, you gotta be careful to not poke yourself there. Even though it is a clean sharp, it hasn't been used on the patient, still dangerous.
Ordering CBC, CMP, and a straight cath for a urine tox.
So they're ordering the basic blood work to figure out electrolytes, blood counts, to see if there's a urinary tract infection. Sometimes a urinary tract infection can lead someone to have altered mental status. Very rare for it to turn into a full-on seizure. I will say in the elderly population, when they come in with some bacteria in their urine, it doesn't necessarily mean that's what's caused their altered mental status. There is such thing as asymptomatic bacteriuria, where they naturally have some bacteria living in their urinary tract, and it's not the reason why their mental status is altered, or that they actually even have a symptomatic UTI that needs to be treated with antibiotics.
Dennis Whitaker. Meet Bob Chazen, a 53-year-old cyclist who injured his leg about 10 days ago on a trip to Utah.
I was in Moab, coming downhill fast and jammed my pedal into my leg.
Ouch. Great description of the mechanism of injury, because without that, there's a lot of details that could be missed.
I've been putting Neosporin on it a couple times a day, but now it hurts to walk.
What do you see, Whitaker?
Outside of the wound looks cellulitic.
What's that?
It's a bacterial infection. We'll need to get you on oral antibiotics.
Figured.
What about the center of the wound?
Kind of looks like there's an abscess forming there, but it's hard to see.
It's a simple hematoma.
Which you can now debride.
It's hard to tell from the outside whether that's true hematoma or an abscess. On the zoomed in image, it looks a little bit better, but you gotta be careful because if there is an abscess, you do have to relieve that pressure, because the treatment for an abscess, unlike what most people think, is just treating the infection. No, you actually have to do an incision and drainage.
Whitaker will take off the dead skin covering the blister to help it heal better. I'll be right back.
Yeah, quick question.
And the danger with cellulitis is that not only it can spread to further down the skin, and oftentimes you'll see like streaking going down the skin because of its spread, it can also spread to joints, leading to septic arthritis, to the bone, leading to an osteomyelitis, and those now have an upgraded level of care where you need to be admitted and getting IV antibiotics, not just oral.
Another 2 of lorazepam.
For a total of 10.
I'm well aware.
He's still seizing. Call respiratory. I'm setting up an intubation chair.
Which he won't need.
Dr. Santos, what is the definition of status epilepticus?
Seizure lasting more than 5 minutes, or at least 2 seizures without full recovery in between.
Excellent.
And after you come out of that seizure, once you break status epilepticus, you can enter something known as a post-ictal state, which is a post-seizure state, where there could be a lot of confusion, where the patient can get very angry because they don't know where they are. There's a level of confusion that sets in, and that can last for seconds to days. I've seen unique situations where that occurs.
Seizure activity has stopped.
Also excellent.
Spontaneous breathing. Good tidal volume.
Sats up to 98.
Welcome back, Mr. Marino.
Now we can do a Keppra load slowly and safely.
Keppra is one of these medications that you need to get it to a correct level in order to have its impact on the patient's seizure threshold. It's easy to overdo it or underdo it, and that's why we do Keppra levels for checking, making sure that we're giving the patient the right dose.
This must have been a bad vial. 8 milligrams should have worked.
According to your textbook of emergency medicine, but sometimes they need a little bit more. You'll learn that with time.
Well, why couldn't I open the vial?
Because you're an intern. Who also needs to learn to trust her senior resident, especially in front of an attending.
I actually like when junior residents and staff question seniors. Obviously, it should be done respectfully in both directions, but questioning keeps people sharp. It keeps a level playing field where there is room to speak up. Even if you are senior, you're capable of making a mistake. And if you create a culture of your juniors being scared to speak back to you, that's how mistakes go unchecked.
Check his labs, babysit him until he goes to CT, and get some blankets on these side rails as a seizure precaution.
All of these vials that are given, they usually have a lot number on them that you can report. So you could check if there are any recalls placed on it by the manufacturer. Generally, they should send a letter if you were purchasing through a legitimate organization, but it can happen where they slip through the cracks.
Is this gonna hurt?
Oh, no. Skin's dead. You won't feel a thing.
I wish he was wearing face and eye protection.
We started riding the Frick Park during the pandemic. You know, just something to do to get out of the house. But we all stuck with it, and
Weird to see a medical student performing a procedure that is somewhat invasive without supervision. Oh! You could tell the pressure was there.
I need a little help here!
First thing you gotta do in that situation for infectious control is wash, wash, wash. Get to that emergency eye wash station.
Hey, what's up?
Arterial pumper under a blood blister.
Let's see.
I don't think it's an arterial puncture, is it really?
No. Hi, I'm Dr. King, and we can fix this.
did you cut an artery?
No. I punctured the top of the blood blister, but there's an artery hiding under there.
Hiding? Like you didn't know it was there?
It was likely tamponaded by the pressure of the blood blister.
Don't you have to know basic anatomy to become a doctor?
He's a student doctor.
Student? Oh, hell no. Can you help me? Can you fix it?
Oh, absolutely. First, we are going to put this BP cuff on to stop the bleeding. A little forward. Here we go. All right, you can let go.
Yeah?
Mm-hmm.
Thank God.
Thank God.
All right, Whitaker, 10 cc's of 1% lidocaine with epi.
The purpose of doing lidocaine with epi as opposed to lidocaine without epi is lidocaine is a numbing solution in order to be able to do sutures. I don't know what procedure she's gonna do, but the epinephrine injected into that region constricts all those blood vessels, so it basically dries up the region so you're not getting a whole bunch of bleeding. There are certain warnings about not using lidocaine with epi on digits and the tip of the nose, areas where you could actually lose tissue, but those warnings have changed over the years.
The shot is going to numb the area and also constrict any blood vessels so that we can put a little stitch in there.
What happened in here?
A hidden laceration of a arterial under the vesicle. Bleeding stopped at 180 on the BP cuff, and we are now injecting lidocaine with epi.
Thank you, Dr. King.
He is waiting way too long to wash off his face.
Okay. A pinprick and some burning.
Doc, can you step in here, please?
You got this, Whitaker.
No, if a patient is asking, you gotta step in at that point.
Now you can place a figure of 8 suture.
I've never done one of those before. Look, maybe you should just do it.
You should definitely do it.
Whitaker's got this.
This is so weird. I can't believe they're doing this.
Just 2 stitches in one. Take a big bite, a simple interrupted suture, anterior to the bleeder.
Okay.
I don't like this for a lot of reasons. Obviously, patient autonomy, patient deserves to be treated by a person with a medical license, A, and B, he clearly doesn't know how to perform the procedure, and C, there's a lot of things that could go wrong with any medical procedure, but now you're opening up yourself to liability to the patient saying, I told you not to do it this way. Why is the student doing this? Even though it could be completely part of normal medical care that something goes wrong, but it will feel like it's because of this.
Now, instead of tying, through another one posterior. Looks good. Now a normal tie for a figure of 8.
What did I miss in here?
I am so sorry. I just...
Made an excellent catch and saved Mr. Chasen's life.
Really?
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 There was a cut arteriole under a blottable vesicle. If Mr. Chasen had gone home without debridement, the blister could have eroded with uncontrollable hemorrhage.
Nice work.
I mean, he could have put pressure on it until he got to the hospital. Been okay, but you know.
Jackson Pollock here might want to go hit the Scrubs Exchange.
This guy lives at the scrub exchange. And I don't know why no one's telling him to wash his face. Like, it went into his eyes. Like, he needs to go and see occupational health stat. They just met this patient. The patient could have a communicable disease. Now, he can have a communicable disease. In a situation like that, you would ask the patient if they're comfortable to check for certain communicable diseases. They don't have to say yes. And in some cases, if you're concerned enough, or if you want to be ultra careful, you can take a prophylactic medication to prevent transmission of certain communicable diseases.
Can someone please help? It's my mother. She fell.
What happened?
I fell in the yard, hurt my arm. That's all. I fell in the rose bush. I'll be fine.
A lot of times during an adrenaline crisis, you may not realize you have more injuries than you feel.
What's your name?
Ginger Kitajima. I'm her daughter, Rita.
Ginger, did you hit your head?
No.
Any chance she could have fainted?
It's always important to ask if the fall was witnessed, and if it was, did the patient lose consciousness, and if they did, for how long?
She's not supposed to go outside anywhere without me. She needs 24/7 assistance with ADLs.
That's activity of daily living.
Are you the primary caregiver?
I'm her only caregiver.
Ma'am, what medications are you on?
Oh, just one. Risperidone. My mom has schizophrenia.
Well, you had a normal EKG and chest x-ray.
That's good. That means that the heart and lungs are okay.
It looks like you sustained a proximal humerus fracture on the left upper arm.
Broken arm.
The bad news is you do need to wear a sling for at least 6 weeks. And that means you're gonna have to step up even more, because on top of your usual ADLs, you're also gonna have to help your mom bathe, dress, and use the toilet.
I'm so sorry, Mom. This would never have happened if I was more on top of things.
It's hard for caregivers. A lot of people don't realize that caregivers take a lot of the stress of their sick family members, loved ones. We have a caregiver center in our hospital in order to help take care of them, give them a place to escape, because it's very difficult to be in the hospital for long periods of time when your loved one is admitted. Obviously, this is an emergency room setting, so most people are in or out, but when your loved one is in an inpatient setting, that could be for a very long period of time.
I know how hard it can be. I was my sister's primary caregiver until a few weeks ago.
Where is she now?
She's in an amazing facility in North Hills.
I know I can be a burden, but I like being in my own home. Just me and my girl. You're not a burden. You're my mom.
I'll refer you to ortho.
Social services. Get the behavioralists in the room. Help them with their family needs.
They'll get you set up with PT and exercises. You're very lucky to have such a caring daughter.
It's also rare that emergency room physicians think that far ahead to start ordering PT, home PT. Part of it is they're not really trained to do that, but also it's a lot of paperwork. When you send a patient for home PT, you need to fill out certain forms known as a face-to-face. You need to have phone calls with the visiting medical professionals, so it's tricky.
Park red Subaru in the ambulance bay?
Oh, yes, that's me.
You're gonna need to move that to open the space for ambulances.
Oh, I'm so sorry.
Okay.
See, I'll walk Rita out. Perla, would you stay with Ginger for a minute? I'll be right back.
Yeah, no problem.
They didn't scan her head. She did say the X-ray and EKG were okay, but she didn't say anything about the head CT. And also, in a situation like that, you don't just want to make sure that the EKG currently is okay, perhaps want to consider doing an echo, which is an ultrasound of the heart. You may want to put on a Holter monitor, which monitors an EKG for a longer period of time, sometimes 2 days, sometimes 7 days, in order to see if there's any unstable arrhythmias in the electrical activity of the heart that can lead someone to syncopize or pass out.
I put in your mom's prescription in at the pharmacy.
Here, giving the prescriptions for the ortho referral PT is great, but I think a cardiologist should probably be involved as well. At least the primary care doctor would be thinking about that. Medication review as well. I mean, there's a lot of instances. There's a lot of factors that need to be evaluated about why someone's syncopized.
Don't worry. Things will be back to normal in a few weeks.
I'm not sure what normal is anymore. I can't even remember the last time I slept through the night. It's a lot.
Do you have any support at home?
I wish. It's just us. I mean, I already work from home, and then there's the cooking and the cleaning and the doctor's appointments. It never ends.
You know, caretaker's fatigue is a real thing.
It is.
You have to take care of yourself, otherwise you're gonna end up in here too.
That's the point of focusing on caretaker fatigue. Because if you don't take care of yourself, it can come to a point where you can't take care of your loved one either, and then both of you suffer. Back to the pit in just a second, but first, I want to tell you about Grammarly, an AI tool that works where you work so you can craft quality writing faster across different platforms. I'm nearly done writing my script for my next animated video about Dr. Edward Jenner's unbelievable creation of the smallpox vaccine. Grammarly's AI writing tools write in my voice, offering high-quality suggestions for how to improve the script. One free feature I love is called Quick Fix. It polishes my writing as I go, helping me stay locked in. With the press of a button, I can accept the suggestions all at once. So easy. They have pro features too, like strategic suggestions. You see, once I finish writing a section, I can ask Grammarly to give it a review and suggest ways to make it better. A lot of this smallpox video is pretty medically dense, but I want the story to be dramatic also. Grammarly helps me thread that needle perfectly. And no matter what I'm writing, I like to make sure I'm using another pro feature called Setting Goals to make sure Grammarly knows exactly what kind of tone and approach I'm trying to strike. Sign up and upgrade to Grammarly Pro to level up your productivity. You can actually use my link in the description for 20% off your pro subscription. All right, let's get back to the pit.
Status, Dr. Moyan?
Still on exchange transfusion and high flow nasal oxygen, but oxygen sats are dropping. She's at 84.
That's really low.
Yes, it is. The goal of exchange transfusion is to reduce the percentage of sickle hemoglobin to under 30%. That is not happening at the rate that your wife needs, which is causing your blood to be unable to carry oxygen, causing further blocked blood cells.
What does that mean?
Dr. Mohan.
To prevent stroke or heart attack, we need to get you more oxygen, but we'll need to intubate.
And sedate. The important thing to flag here for the patients is that this level of sedation will be a temporary measure to allow the patient to recover. Whereas in some situations, you're intubating patients in a very futile manner, as we saw with one of the earlier patients in the first few episodes.
Acute chest syndrome can progress very quickly. It is the most common cause of death for patients with sickle cell. It is imperative that we intubate.
I don't know.
Why don't we give you and Ondine some privacy so you can talk?
Jake! There he is. The man, the myth, the legend. The kid stole my concert pass and gave it to a girl. Where is she? Do I get to meet her? Hold that thought. Okay.
Travis Johnson, 17, had a tonsillectomy 10 days ago at St. Michael's. Started spitting blood about an hour ago. Good vitals.
Had his tonsils removed, and now there's some kind of post-surgical bleeding?
How much blood?
A couple mouthfuls.
Can you open up for me?
Sutures ruptured?
Hey, Whitaker, Jesse. Got a post-tonsillectomy hemorrhage. Nebulize TXA quick as you can. Let's go. Trauma 2.
Go.
So this can go south pretty quickly. You up for it?
Well, I can.
Of course you are.
You want to get the suction ready to go just in case.
Take long, slow, deep breaths on that. The TXA is going to help your blood clot.
Hey, any medical problems?
No, just a ton of strep. That's why I had the surgery.
We've changed our guidelines when it comes to performing a tonsillectomy for strep. Before, it was done much more often. Now, there's a set number of times that you need to develop strep in a year in order to qualify for this, or there needs to be a breathing reason why, like an obstruction of why you need the tonsillectomy.
Okay, sure. You feel like throwing up? Any pain in your belly?
No.
If you swallow enough blood, it could also cause a significant gastrointestinal disturbance.
Labs?
CBC, BMP, maybe coags.
Add a type and screen just in case.
A type and screen in order to know what blood type the patient has in case they need to transfuse. If they know the blood type, they can transfuse that specific blood type instead of using a universal donor.
Good sats of 98%. BP's 115/80.
That's a good BP. That means that he's not lost so much blood that he's becoming unstable.
Your parents on the way?
They're in Baltimore for a wedding. I didn't want to bother them.
Trust me, they're your parents, and you are in an emergency room, and he's never a bother. Write their numbers down, and I will call them. Call ahead and neck. Stay with him until they get here, okay? Good. Pen?
Can I get it?
Sam Wallace, our good Samaritan who saved a Nepali lady, is in line for a repeat head CT to be sure there's no extension of the intraparenchymal bleed.
Okay, so we can dial down the sedation, and if he's alert, check extubation parameters.
Copy.
Did you get the consent form signed by Joyce the stickler for the intubation?
Not yet.
Jesus f***ing.
She's scared. I just want to give her some time to talk
To do what? Make funeral arrangements? Joyce is hypoxic at 84. 84. This goes on much longer, she runs the risk of permanent lung damage, heart attack, stroke, death.
I know.
Then move.
The reason why you want to intubate early in several respiratory diseases, including this one, as well as asthma, is you don't want to let the situation progress where you're performing things in an emergent manner. You want to have things controlled. You want to be able to treat the problem in a careful manner as opposed to trying to rush to do it because you have no other choice and the patient's decompensating.
I'm Dr. Heather Collins. You must be Christy and Lynette Wheeler?
Yes.
Yes. I see we're doing a medication abortion today, correct?
Yep.
Well, since I didn't initially assess you, do you mind if I ask a few questions? Get up to speed?
No.
So they say medication abortion. It's good that they use the term medication because some people refer to it as a medical abortion, but medical to a patient doesn't mean medication. Surgical sounds medical, but those are two different things. You could have a medication abortion, or you can have an aspiration abortion or a surgical or instrumentation abortion. In a situation like this, the fact that they're choosing medication abortion likely means that this is happening in the first trimester, usually before the 12th week. They've gone over the side effects, the benefits, the differences between someone getting a medication abortion versus aspiration, because there are subtle changes that might make a patient choose one over the other. I will say most choose medication route, but there are differences.
Is this your first pregnancy?
Yes.
And you're 17? When did your last menstrual cycle start?
Not exactly sure. End of June.
It's important to get the LMP, the last menstrual period, because it allows us to create a date for the gestational duration of that pregnancy in order to be able to decide which is the safe approach in order to get the patient the best care. You could use ultrasound in a scenario like this, or if the patient is unsure, or if the patient gets irregular periods. Those would be reasons to perhaps do some blood testing and ultrasound testing.
I need to do another quick ultrasound to make sure everything's okay for the medication.
Not always necessary for medication abortions.
A little jelly on the belly? Sorry, it's cold.
The good hospitals allow that to sit in a little warming tube, so it's not cold.
Is everything okay? Yeah. Christy Wheeler, 17 years old, pregnant. These are Abbott's fetal measurements from yesterday, and these are mine.
10.5 and 11.2. Wow, ultrasound is an art, not a science. Even in the very best hands, the EGA differential can be within 3 to 5 days in the first trimester. Definitely room for error.
Not if you're here for a medication abortion and you're past the mandated 11-week cutoff.
It really depends on which organization you're looking at. Some organizations have it around 10 weeks, some have it 11-week cutoff. There are some that have a protocol of 12-week. And you also gotta understand that because of the current federal rulings, states have a lot of different discretions and rules here. Some states have absolute bans. and some have very strict restrictions, and it's really gonna differentiate what level of care you get when you do seek a medication or surgical abortion.
I didn't get a single measurement under 11 weeks.
So what are you saying, that Abbott lowballed his measurements to help a teen get the abortion that she wants?
Baby.
Well, then you've got two choices. You can go with Abbott's measurements, or you can redo your measurements, go back in and pick an angle that shows 11 weeks or less.
I'm curious why they decided to redo the measurements in the first place.
Falsifying medical records for Christy is flat out illegal.
She's 17. She deserves a life.
Of course she does. But I will not jeopardize my future in the process.
You'll be fine.
I want to look up what the rules in Pennsylvania are. In Pennsylvania, abortion is a safe, legal, reproductive health option through the 23rd week of pregnancy.
Someone finds out I falsified medical records, I'll get booted from the residency program. You've got tenure. Worst case, you have to take a job in Youngstown. The risks are not the same for you as they are for me.
You're right. I'll do it.
What?
Erase your history, physical, and impression from Christy's chart and be like you never saw the patient. I will take over. I will complete a new chart and upload my own image.
Robbie, I'm not asking you to.
As you're attending, it is my decision. I am a certified provider for mifepristone. You are not.
Mifepristone is the abortion medication that is given, usually with another medication, in order to complete the abortion. And you do generally have to be certified in order to prescribe it. And some pharmacies will need the certification to deliver the medicine.
Okay, crown to rump. That's top of the head to the bottom of the butt. It's how you measure gestational age. And we are at 10 weeks and 6 days.
I made it by 1 day.
I will order the medication. Dr. Collins will go over instructions on taking the pills when they come back from the pharmacy.
I don't work in a center that provides abortions on the regular, so I'm not familiar with this exact dosing strategy, but I know that you can give the medication up to 12 weeks. Off-label use of medications is totally acceptable too. They could have just said that.
Thanks.
Where's Teresa?
She went to park the car. Shouldn't have been more than 5 minutes.
Yo. Sole caretaker, overwhelmed, exhausted.
Eloped?
I told her to take a break, but you don't think she ditched her mom, do you?
I mean, it happens.
No. He had the surgery at St. Michael's, but he's here now. No, he doesn't have a car. His parents are out of town.
This happens a lot when you call specialists. They try and either punt it away to another specialty or say that there's no urgent need to follow up in an office setting. So you really have to do a good job advocating for your patients.
Okay, well, how am I supposed to send him back to St. Michael's? We'll call him an Uber? You can't... That doesn't make... Hey, hello? Hello?
In situations like that, getting your senior to call and advocate for the patient could be a reasonable step.
They said it is not their job to fix another hospital's problem. Don't worry about it, though. I'll talk to my attendant.
Oh, this poor guy in his scrubs, man.
I need a little help here!
Okay, come on, open up.
That's a post-tonsillectomy hemorrhage.
Yank out and sponge stick.
So in a situation like this, you want to address both the airway by creating another airway lower down and to stop the bleeding as quickly as possible.
If head and neck still won't come down, call Garcia.
Again, poor guy needs to go wash off his face.
Okay, before we begin, let's take a timeout.
This is Joyce St. Clair. Procedure is endotracheal intubation for hypoxia due to acute chest syndrome.
This is called the timeout, and this was instituted in order to decrease medical error, to aid in patient comfort, and it's an overall valuable thing to do before a procedure.
Robbie, trauma 2 right now.
Cover the intubation.
Of course.
What happened?
A bleeder opened up.
Ketamine on board to intubate.
That's holding at 97. Can you get an airway?
Come on. Let's lie him down. Keep pressure on the scab. Nothing but blood. Can't see the cords.
SAS 94.
Not sure we have room for the tube with the sponge stick.
If I pull out, there's gonna be even more blood.
Doesn't look like you secured that airway.
We're working on it.
Bougie.
Open a crike tray and prep the neck.
Yeah, the neck is really the way to go in a situation like this because there's just massive bleeding there.
Okay, hold on. We can try retrograde this patient.
A what?
There's no obstruction, we just can't see what we're doing. So we take a needle and we put it in the cricothyroid, and we run the guide wire up and out the mouth, and we slide the ET tube up over the wire.
Never seen one before.
So that's 90.
No time to play MacGyver with this kid. Time to crank.
Did be quick.
You got one shot, and then I cut.
So he's literally going to try and create a guide for the patient by going into the airway through the front of the neck, creating a guide wire, and then bringing it back down in order to guide the ET tube directly into the lungs. Because the difficulty in intubation is finding the airway as opposed to the esophagus.
Okay, I'm in. Guide wire. Let me know when you start to feel it up top.
So that's down to 89.
Guys, this is not working.
Just give me a second.
Until you rest?
Oh my God, I'm gonna lose another patient.
Stop, Whitaker. He's got this.
So that's down to 87.
Okay, I'm gonna redirect the wire.
So that's still dropping, 86.
You got this.
Excellent view of the cords, Dr. Mohan.
I'm in. Inflate the balloon. Good breath sounds bilaterally.
Sats 92 and rising.
That's it? You're done? Yes. It all went perfectly.
Again, you see how calm that insertion was as opposed to imagine she's crashing, she can't breathe, she is now completely out of it. There's screaming, there's people running around, but this was well planned, well controlled, therefore less likelihood of error, side effects, etc.
So that's 84. We need to bag him.
Still not seeing it.
Stop spinning like crazy.
I just don't know why they're not doing the crate.
All right, we tried. I'm sorry.
No, wait. I've got it.
You still don't have an airway.
Keep the laryngoscope in place so the tube passes easily. Pass the T tube over the wire. Come on. Hang on to that wire. Do not let go of that wire.
If you lose the wire, you no longer know where you're going.
Okay, I'm gonna give you a little slack so you can get past the cords. Yeah, I feel you at the trachea.
25 centimeters at the lips.
That ought to do it. Pull the wire, bag him.
Balloon's up. Yellow on CO2, that's good.
Yeah, that's good that the intubation is done, but the patient's still bleeding pretty bad, so you need to solve that issue.
Good breath sounds bilaterally.
Remember, ABCs of trauma. Airway, they just put in. Breathing, the patient's breathing. He's saying good sats, good breath sounds. But circulation, that's the issue. And they're acting like it's totally fine because he's putting some pressure. It's enough. That can change very quickly.
I'm sorry that took so long. I was just...
Don't apologize. What you did in there, building a relationship with your patients, earning their trust, it's what this is all about.
Robbie doesn't seem to think so.
It's a balance. Yes, you want to build the relationship. Yes, that's important. But at the same time, you also have to be practical and think about helping not just that patient, but also the other patients and yourself and the medical situation at hand that could be timely.
Keep doing you, Dr. Mohan.
Where'd you get that move? Retrograde intubation, that's an Adamson special. I learned that from the best.
Wow, you're not too shabby yourself, Professor.
Yeah, that got kind of rough in there. You kept your composure, though. Exactly the kind of candidate they want for the ED Medical Education Fellowship.
Oh, there's probably over 50 applicants for that one slot.
Yeah, probably. But I know that they like to go with someone that they know from firsthand experience has the skills to be successful. At least that's what I told them in my letter of recommendation.
Letters of recommendation are very important in the medical community, whether it's going to medical school, doing a sub-internship, selecting an internship or residency, fellowship, hiring. You could tell that there's a lot of steps in the healthcare journey.
Since your past 10 weeks, you'll need to take mifepristone twice, once now and once in 24 hours. Then 24 hours after that, you'll take misoprostol, 2 pills which dissolve between the cheek and the gum. Then 2 more of the same pill 6 hours later.
It's a lot to remember.
Everything is clearly labeled with the names of the meds.
This is why some patients prefer to go for an aspirational abortion, because it's a 15-minute procedure, outpatient. There are no instructions for you to go home and follow. And generally there is less bleeding, less cramping, Even some studies have shown less major side effects in comparison to medication abortions. And the effectiveness obviously is higher.
Will it hurt? You can expect some vaginal bleeding. Maybe
Cramping?
there may be some cramping, like when you're on your period. If you're bleeding more than 2 pads an hour, or the pain gets to be too much, come back in and see us.
And I'll be with you the whole time.
Christy! What the hell are you doing here? Language. And I should be asking you the same thing.
Excuse me, who are you?
I'm her mom.
Mom?
Uh-oh.
Aren't you her mom?
I can explain. No, that's my sister, Lynette. I am Christy's mother. Chris? Chris, baby, what are you doing here?
I'm here for an abortion.
Did you do it already?
Not yet.
Okay, thank God.
Okay, can we all just take a step back here?
Mom, I want this. This is my decision. No. Just listen to her.
Okay,
Shut up. You have done enough. My daughter is a minor, so she can't get this abortion without my say-so, right? Is that right?
That's correct.
Oh God, so many rules in different states. Pennsylvania requires that one of your parents or your legal guardian give permission for your abortion. A judge, however, can excuse you from this requirement. Now, how about where I mostly practice? No parental involvement required. That's what I was gonna say, see?
There is no way this is happening. Not now, not ever.
It's pretty incredible to see firsthand right here, just in this episode, how much politics plays a role in reproductive health care, between the number of days, whether or not the medication can be used, whether the mom or the aunt is allowed to be present for this child to get their medication. It is so complicated, and there are so many issues at play, both cultural, ethical, medical, and they all have to be discussed to some degree in every visit. Speaking of reproductive health, I actually asked my teen nephews what they knew about reproductive health in this video. Click here to check it out, and as always, stay happy and healthy.